Hi everyone, this is Rick McDermott. I'm going to show you how to self-enroll in a 2021 Part D drug plan in a governmentally compliant, superior way online. So take a look at this video and we will show you how to do it. The first thing you want to do is, if you haven't already, which obviously if you're watching this video you already have, go to seniorsolutions.net, which is our website right here. And then you can click on the 2021 Part D Drug Plan Enrollment Resources, which will take us to the video that we're on right now. So what we're going to do is we're going to show you how to self-enroll. We also have written instructions as well if you'd like to print them out or look at them side by side. The first thing we're going to do is we're going to select Part D Drug Plan Self-Enroll. By the way, you can use Medicare.gov. There are a few other plans on that site that we don't represent, but if you want us to be your agent of record, then you can use the seniorsolutions.net and we can contact the plan on your behalf if you have any issues that you need to address throughout the year. We're going to pick a zip code. We'll pick 98902 and we'll click View Plans. And this is one of the most critically important parts that you need to select. So you're going to have different tabs up top: Medicare Advantage plans, Medicare Supplement plans. The only tab that you want to select is this Prescription Drug Plan tab that has 16 different plans to pick from. So we have a wide range of plans to pick from. And then you'll see the plans listed by cost. You'll see the Aetna SilverScript, which has a brand new plan in 2021 for $6.30 a month. That is a plan mainly for people who don't take prescriptions or they just take generic drugs and they have a pharmacy that is in the preferred Aetna network. So if you're on a lot of drugs, you may not benefit from that plan, but we're going to find out the best, most easy way to get the best plan for you. So what you're going to want to do, especially if you take prescriptions, is you're going to want to go over to the Add Preferences, orange tab, and now we're going to enter in our prescription drug costs. So we're going to want to make sure that we're on prescription drug plans, not Medicare Advantage or Medicare Advantage and prescription drug plans. You only want prescription drug coverage. If you want to look at Medicare Advantage options, contact us and we can talk to you about your options. But those of you who are on Medicare supplement insurance like Plan N, Plan G, or maybe Plan F, this is a fantastic process to use. So then we'll click Continue. The only reason you'd want to answer any of these questions here is if you know 100% for sure that you qualify for extra assistance. So most people do not qualify for extra assistance. So you can either click No, I'm not eligible, or just hit the Continue button and skip those questions. Now what we want to do is we want to enter in some medications. So let's pick a couple. Let's pick lisinopril. And now you can change the dosage around. You could go from anywhere from 2.5 all the way up to 40. So let's pick the default of 10. And then you could either select a 30-day supply or a 90-day supply every 3 months. In this case, we'll use 3 months at a time. A lot of generic drugs you can get 3 months at a time, and you want to make sure you hit the Add button as well, because if you don't hit Add, then it will not add your prescription to your list. So then we'll pick atorvastatin, which is cholesterol medication that's very common, and we'll change this from 10 milligrams to 20 milligrams, and we can also change the dosage from 1 per month to a refill every 3 months. So 90 pills every 3 months would be 1 a day. Now if you took 2 pills a day, obviously you'd want to double it and make it 180. But for now we'll leave it at 1 pill per day every 3 months. And we want to make sure again to hit Add. And we'll hit another one that's more common these days, Eliquis. So Eliquis, we'll pick the 5 milligram dosage. And in this case, we'll have a 2 a day, and we'll get that every month, let's say. So we want Eliquis 60 pills every month, 60 tablets per month. So we've got 3 prescription drugs, and we'll hit continue. So let's say we are done adding drugs. Now we want to pick a pharmacy. So you can see there are 36 different pharmacies in the area, and we will select on page, so you can scroll down and see all the different pharmacies that are listed. If you don't see the one you like or like to go to, then you could go to the next page until you see the one you want. So we'll go to page 3 out of 4. We'll say Safeway Pharmacy on Summit View Avenue. So now we've added Safeway Pharmacy up here. We've added our medications. Now we'll hit continue. So now we'll see the plan order change from the least costly plan per month, which was the SilverScript plan, to the Aetna SilverScript plan for $31 a month. So you can see that $6 plan is down on the list. It's down quite a bit down, almost to the bottom. Yeah, $6.30 a month. That plan would not be the most ideal plan in this situation. Probably because of the Eliquis. So you can see 3 out of 3 drugs are covered. Your pharmacy's in network. Your estimated cost for the drugs is $1,037 for 2021, and your total cost when you add the insurance cost would be $1,412. Notice the next plan down through WellCare would be $1,505. So you want to gravitate to the plan on top, the very first plan. So this is a very, very easy tool to use. So as long as we're using the total estimated annual cost, it will automatically arrange the plans to be the most cost-effective plan on the top of the list. So watch what happens as we scroll down to this total estimated cost. You'll see it's going to get a little bit bigger the further down we go. So you can see at the very bottom, that's $7,000. So in this case, Humana Walmart would be one of the least desirable plans to enroll in if you don't want to use Walmart as your pharmacy. So we'll go all the way up to the top. Now what we can do is we can look at the plan details. We can also compare multiple plans side by side if you'd like to. And then you can hit the compare button. But for now, we are going to go with the first plan on the list and look at the options. So if we click Plan Details, you'll see the premium per month is $31.30 a month. The estimated drug cost is what you pay when you actually go to the pharmacy at Safeway, for a total cost of $1,412 for the year. And it shows what the co-pays are for each tier, tier 1, 2, 3, 4, and 5. And then there's mail order pharmacy options as well. And then we can also itemize your prescriptions. So if you click prescriptions, you can get a cost of each drug. So these are 2 inexpensive drugs. Atorvastatin and lisinopril, very inexpensive. There's no copay at Safeway. So this retail cost would be the total cost of the drug, 55 cents for lisinopril. 0 copay for you. Your cost during the donut hole if you hit the donut hole or the gap, and after the donut hole or in the catastrophic phase. You can see the Eliquis, however, the retail cost is almost $500. The cost before the donut hole, the cost during the donut hole or the gap, and after the donut hole. So there are different phases. There's the deductible phase, the initial phase, the coverage gap, and the catastrophic cap. Those phases are the same on every single drug plan in the US. So all drug plans must follow the same exact formula. So if we look at the total estimated cost, you can get a month-by-month breakdown. So you pay 0 for lisinopril, 0 for atorvastatin. you'll have to pay the deductible for Eliquis in the month of January. So then in February, March, April, May, June, July, so if we click on the month of February, you can get the actual breakdown. That's what you pay for the premium, for the drug itself, for the drugs themselves, and then the total cost for the month of February, March, April, May, June, July, August. September, you have a higher amount because now you are in the donut hole because of the cost of Eliquis. So you're going to pay a higher amount for Eliquis in the month of September throughout the remainder of the year. So if we've decided, well, we've looked at the plan, we've decided this is the best plan for us, then you can simply add it to your cart, and then we could continue on to the application. So these applications are pretty straightforward. You will need your Medicare number, and you want to make sure you accurately put it in. Leave the dashes off the Medicare number when you enter it in. So we cannot actually apply for this plan until the 15th of October. So you want to make sure, again, that you pick your plan based on dollars and cents. All the plans follow the same formula that the government institutes as far as the donut hole is concerned. And once you hit apply, you can also download the plan documents if you choose and read them at your leisure, but you're not required to. And when you apply for a plan, you will automatically be disenrolled from your plan from the year before. So you do not need to cancel your existing plan. Medicare will take care of that for you. So if you have any questions, don't hesitate to reach out to us. And it's been a pleasure. I hope you find this beneficial. And again, thank you for using us as a resource. We appreciate it and we don't take it lightly. Thanks so much.